in, but it was fine, but now it doesn't dislocate, but I can't, like, it hurts to put deodorant on, like, it hurts this high, and any sudden movement, it's like, so, I don't know. So my pain could be like a 2, and then the next minute, it all depends what happens, it's like an 8, 9.
Dylan, is there anybody else waiting, or?
I don't see anyone else.
No, okay. You wanna tell Joe we'll get started?
Okay.
Want to use the restroom?
I think there's one more lady coming in.
One more person coming.
We just deal with them for another couple of minutes.
How long is this usually?
About 45 minutes.
How long have you been here?
In Jefferson Township, 35 years. In this particular location, since 2008. Just been in other buildings. Are you folks all from around here, Jefferson, or?
I'm West Milford.
Okay.
Berry Lakes.
I'm sorry?
Berry Lakes, Hollow Lakes.
I see,
Not too bad? Okay.
Where am I going?
Right back here, yep. Yeah, you get to have a
So you're
seat.
orthopedist?
okay.
Looks like up front rows.
You're not orthopedist?
Hello. The latecomers get the front row.
Prime real estate.
Yeah.
Okay, yeah, let's get started, I
Okay.
think, because anyone else will kind of flowingly.
Yeah.
So I spoke to most of you over the phone regarding shoulder pain. I'm Joe. I wear 2 hats here. I'm the patient relations coordinator, as well as an exercise physiologist. I've been working at Hospital of Special Surgery in the city for the last 3 years, and I just joined Dr. Raji's team a couple months ago. So she's my mentor. She's been in practice about 35 years.
40.
40 years. So she's a community staple. So everyone should have got a survey and a shoulder rotator cuff workshop kind of note-taking sheet, as well as a business card. So feel free to take notes to kind of leave here with. All right, and then we'll discuss plans of action after this. All right, so without further ado, Dr. Raji, take the floor.
Thank you. So, I would like to welcome all of you to tonight's rotator cuff and shoulder pain workshop. And this is where we discuss about helping people with pain get back to normal without unnecessary medications, injections, or surgeries. Long-term medications anyway, so. So just to tell you a little bit about myself, I've been a physical therapist, a doctor of physical therapy for about 40 years. And I founded Opt Physical Therapy, and we just completed 35 years. So we're very excited about that. And I just want to tell you a little bit about my own personal journey with my shoulder. I was in a car accident about 10, 12 years ago, and I have a rotator cuff tear myself, which, completely was rehabilitated with just physical therapy. And having gone through that, and having treated numerous people with shoulder conditions, rotator cuff I saw the benefit of, treating, without any medications, to having gone through my own shoulder. And I found that, most patients or most doctors don't even think about, why don't we try something, medication first, and so I decided to start doing these workshops just to, bring, that knowledge to the, general public, that, hey, try physical therapy first, it works. If it's not something that works for you, then you can go on to the other options. But, this is a good, conservative approach, without medications, injections, or surgeries. And, so here we are. So of course, that was about me, and I think I got a chance to meet everybody else except for you. So if you wanna, hi, if you wanna just quickly tell me your first name and just a quick, what's going on with your shoulder.
My name is Fizzy, and I am a wedding photographer. So I carry heavy cameras on my shoulders for hours,
Okay,
and keep my hands above my head for many
right.
minutes at a time as well. And right now, the pain is to the point where I wanna show my arm more. So that's where I am.
Oh.
Hello, everybody.
So, without further ado, we'll dive right into the presentation. So in order to understand, what physical therapy can do, it's important obviously to know what the shoulder, looks like underneath the skin. So this is an overview of, the shoulder and the rotator cuff muscle group. So as you can see, this is the arm bone, and this is the shoulder joint, okay? This is actually anatomically called the glenohumeral joint. So this cavity here, this little cup, is the glenoid cavity, which is part of the shoulder blade. And this is the arm bone, which is called the humerus, and that's why it's called the glenohumeral joint. So this alone is the shoulder. The rest of it all is the shoulder girdle, okay? And that's because it's the foundation for this glenohumeral joint. And the rotator cuff is basically a group of 4 muscles that attach to the shoulder blade, as you can see right there, to the shoulder blade and to the arm bone, so that it helps to move the arm. And the 4 muscles are attached in a way where 3 of them are on the back part, on the back side of the shoulder blade, and 1 is actually underneath the shoulder blade, where it holds the shoulder blade to the rib cage. And in addition to the rotator cuff muscle group and the glenohumeral joint, there are 4 other areas that work together. That is the neck, the collarbone, the shoulder blade, of course, which we talked about, and the rib cage. So all of these need to work in good harmony for an individual, for us to be able to lift the arm. So if any of those areas is not working properly, you're going to have difficulty moving the arm and using the arm, without pain. So now let's talk about the pain that you all mentioned, right? Is your pain reproducible? And what that means is, if you are basically just sitting or standing, not using the arm, and you have no pain, and you go to use the arm, you go to reach or lift or something, and you get pain, that means the pain was reproduced, right? You didn't have pain and then something caused it to happen. So typically it's any of these day-to-day activities that could make your pain either worse or actually cause the pain. Any of you get this with getting dressed, like reaching behind you or trying to take off a shirt, right? Yeah, so that means that the pain is reproducible. Then there is a cause, and and that means that the pain can be reduced, okay? So that's what we'll look at later on. So when we as human beings, when we encounter or experience pain, we typically deal with it in, 3-4 different ways, right? So first of all, let me ask you this. Do you think pain is a good thing or a bad thing?
Good thing,
Okay, why?
because it warns you that something's wrong.
Okay. And is pain bad? Does anybody think pain is bad?
I don't wanna be.
Well, nobody wants to be in
Oh, we
pain,
don't
so
like
it's
it.
bad because it's bad because
You
you're in
don't want it.
pain.
Exactly.
Yes.
So, that was a trick question. So the pain, of course, is bad because it hurts, right? So who wants pain? So from that point of view, it's bad, but yes, so it's a good thing because it's warning you that something is wrong, right? But what do we do when we experience pain, right? The initial thing is always to just ignore it, right? How many of you have just ignored it, saying, it's not that bad? I heard many of you saying that already, right? It's not that bad, which is a form of ignoring it. Or just justifying it, saying, well, it's not that bad, or I'm just getting old, well, I used it too much, and like, it's so mild, and it only happens once in a while, so nothing is wrong, okay? So that's typically the first reaction that we all, have to pain. The other thing that we most commonly do is to just alter it or just modify it or mask it, right? How many of you have done that? Just take medication to get rid of the pain, get an injection, or just avoid whatever is causing the pain, right? So, I've had people come in, if they are, right-handed, and it bothers them to reach the top cabinet, they're not using that right arm. I'm reaching with my left hand to grab the dishes from the top cabinet.
That's what it's there for, that's what you guys do.
That's what's it, because when I did the one with my left shoulder,
Yeah,
they said just use your right, just compensate and use your right
Right.
more than your left.
yeah,
Because
I
you're
mean-
left-handed, so that was naturally your where your strength is.
Right.
And whether you're lifting something or so, I would compensate to my right. And then they said, but the same thing will eventually happen to the right. Eventually.
yeah.
Because of the
So,
work I was doing.
right, so typically that's what we do, is, now you start, altering or modifying or just masking the pain by avoiding the movement that gives you pain and hoping that, you're just basically just, trying to get through each day, avoiding the pain. But what is the best thing to do is to really deal with the pain and handle it and fix the cause of the pain, right? So that it goes away permanently. So you want to get to the root of the problem, okay? So in order to do that, it would help to know what are the common causes of shoulder pain. And we're going to take a look at this one by one. These, of course, are the 4 common causes. There are other causes as well, but we'll take a look at this one by one. So, if the problem is actually in the neck, and this could be, where you actually have a pinched nerve, or the nerve is pinched somewhere along the root of the nerve. So it could be, a muscle tightness, muscle spasm, that's causing pressure on the nerve and actually giving you tingling or numbness in the arm. Anybody here with tingling or numbness in the arm, in the hand?
In the fingers,
Yeah.
sometimes,
Mhm.
yes.
Okay, so it could be a component from the neck, or it just could be, the nerve along its pathway is being impinged, with muscle tightness. So, often the problem is in the neck, and you're experiencing tingling in the upper arm or the fingers, and you think that the problem that you have a shoulder problem, but the cause of the problem is actually the neck. So, the next most common cause of shoulder pain is impingement. Anybody heard that word? Okay. So an impingement is when, there is pinching of a tendon. Most commonly, the supraspinatus tendon, which is one of the rotator cuff muscles. And you could all try this, is if you just raise the arm sideways and you experience pain, only in like one part of the movement. So you literally have like no pain up to about 45 degrees, and then you start to feel pain, and then you go up to there, you have pain, and then the pain just goes away. And that's what an impingement is. And it's called an impingement because this bone that you feel here is your acromion bone, which is part of the shoulder blade. And the rotator cuff tendon of the supraspinatus literally travels underneath that bone and attaches to the shoulder. So what happens is, over the course of time, and especially because, the nature of our lifestyle, human lifestyle today is like, we do a lot of sitting. And what do? We all sit slouched. So we are always having this forward, our shoulders are forward. And this part of the shoulder, tends to become tight. So the space underneath that acromion, because of this poor posture, the space is narrow. And so when you try to move that arm, that tendon doesn't have any room to move, and so it's getting pinched. And that's what gives you the pain. So an impingement, again, is, a common cause of shoulder problems. Then we have tendinitis. Most of you must have heard of that word too. Tendinitis is nothing but inflammation. So the word itis means inflammation, and tendon is this white part. It's the part of the muscle that actually attaches to the bone. The muscle always attaches to the bone through the tendon. And when that is irritated or inflamed, it's called as tendinitis. And when that's irritated, it gives you pain, and so that's what tendinitis is. And last but not least is a rotator cuff tear. Rotator cuff tear could be a tear in one or more of those four muscles that we talked about. The tear could be either at the tendon, it could be in the muscle fiber, it could be both, it could be a complete tear, it could be a partial tear. So there's several different aspects to a tear itself. Most times when there is degeneration just from use, people have tears and you don't even know it. So having a tear is a common thing that just happens with everyday life over the course of time, And what happens is that sometimes when you have a traumatic tear, because you either have a fall or you pulled whatever you did, you took an axe or something, right? And you end up straining the shoulder and you end up having irritation, and so it's that irritation that's actually giving you the pain. It's not the tear itself that actually gives you pain.
Does that ever repair itself?
No.
Once there's a tear?
It depends on where it is. If it's where the tendon is attached to the bone, like I have a tear where the tendon is attached to the bone and it's a partial tear, but that will never reattach. But if it is in the muscle fiber, that can heal by forming scar tissue. But the healing, really, once you get rid of the inflammation, you can get rid of the pain and then just strengthen the area and and actually be functional again. So not everybody who has a tear needs to have surgery, So reversing your pain, which is fixing the cause of your pain with physical therapy. That's what you're all here for, right? So what happens is, in order to, fix or figure out the cause of the pain, we do have to do an evaluation. And at the first visit, we basically test to assess your overall issue and your overall status. So we wanna know more about, the symptoms that you're experiencing, right? When do you have pain? How much pain do you have? We're gonna test different movements of the shoulder girdle, the neck. We're gonna look at the areas above and below the area of pain. And we're gonna test for impairments of strength, flexibility, mobility. We're gonna check for muscle spasms. We're gonna check your daily activity, meaning, your everyday life. If you're a photographer and you're doing this all the time, how do we, help to minimize the pain in somebody who's using their arms overhead all the time? Those are all the challenges that we have to face and help you with as a clinician. Another very important part of the assessment is the posture. And as you can see, today we have this challenge where everybody's sitting, working from home and, working at a computer. So sitting posture is a huge problem, causing a lot of neck and upper body, shoulder pain and so on. If you take a look at this young lady, you can see how her head is sticking forward, her upper back is slouched, and when that upper back is slouched, what happens is that the upper back is rounded, so the shoulder blades that sit on either side of the upper back, they tend to turn forward. When they turn forward, what happens is that glenoid cavity that I talked about, where the arm bone sits in there, the mechanics of how that arm bone has to sit in that cavity completely gets altered, because now the shoulder blade is turning this way. So if that bone is not able to sit in it the right way, it's gonna give you pain and it's gonna limit your movement. Also the muscles that are attached to your neck and your shoulder, they get completely altered. The mechanics of how they're supposed to work gets altered. And so if they're not able to work the way that they're supposed to work, you're gonna have pain, you're gonna have limitation, and you're not gonna be able to do the things that you like to do, or that you need to do to get through everyday life. So once we do that evaluation, that helps us put all the pieces of the puzzle together, so that we can then come up with a successful, a treatment plan, which is your plan of care, which is a successful treatment plan, which is unique to your condition. And that's gonna include, the working through the different phases of healing, modalities and hands-on techniques, and we'll go through this one by one. Stretching and strengthening exercises, and modifying your environment, which is, again, I'll talk about that a little bit more. So the first phase is to help reduce the inflammation, and that helps to minimize the pain. Now, how do we do that? So in order to minimize, inflammation, if you do have a condition, if we think, you have any kind of tendinitis or irritation in the muscle, in the rotator cuff muscle, or the biceps muscle, or what have you, we may recommend using modalities like, we have the Class 4 laser, and the laser is a state-of-the-art technology that really helps to reduce inflammation in the muscle or in the joints surrounding of the shoulder. So that's just one aspect. We would also show you corrective movements, correct positioning, so that you are taking all the strain off of the tendon or the muscle that's giving you the problem, that's the source of the problem. And with that, what happens is that once the strain is taken away, that helps to reduce the pain. So that's the first phase, is where we're gonna work on reducing inflammation, reducing irritation, reducing strain, to help to minimize the pain and start the healing process. Okay, So once the pain starts to subside, we can gradually start restoring normal movement and normal flexibility, and this is when we start, working on stretching and flexibility and mobility exercises. And this will, of course, again be to gradually work towards bringing back, full normal movement without pain, right? Pain-free, you want full pain-free movement, so that's what, that phase, we work on that phase. And once we have, pretty good, range of motion without pain, we've minimized the pain, we've improved and restored, a lot of the flexibility and the mobility, then we start working on strength. And, once you have the strength and the flexibility, then you can start going back to, normal function again. And, then you gradually work on picking up that axe again. So, it's important that the strength and the flexibility is built up, because you need to recondition the area in order for it to be able to sustain itself. So it's very important, you have to be proactive in seeking the treatment that, gives you long-term relief. Because medications and injections and those, yes, they are important sometimes if the pain is extremely severe and you need that, you may need that, but that's only gonna give you temporary relief. Until you recondition, the muscles and the joints, the pain will come back. You need that for the body to help be able to sustain itself. Those muscles and those joints need to be able to, work and be strong enough to sustain, the proper position of the muscle and be able to work in harmony with the other muscles around the area, so that you can function, without pain. So to put it all together, you want to pay attention to what your body is telling you. Small problems can become huge if you just procrastinate and you ignore the problem. And physical therapy is the most effective. Research has shown that physical therapy is the most effective of all medical options without the need for injections, long-term medications, or surgery. So, you need to be an advocate for yourself. If your doctor has recommended that, you may need surgery, or, get an injection, or, take this medication for so long, and you are hesitant to do that, you can suggest to your doctor that, hey, is it okay if I try a conservative approach? How about if I try physical therapy first? So you would need to be an advocate for yourself. Which to some extent you all are, because you're here, right? Came here to learn more about, what are your other options. So, I just wanna go over some frequently asked questions, because these are frequently asked, and so I figured I'll, might as well address these. So, first of all, very important, can my pain return? So, if you do not complete the course of the physical therapy, yes, you always stand the risk of the pain returning. And that is because the physical therapy and the exercises that are given to you, by us, they are a prescription. They are like medication for the condition that you are undergoing. So if you, had an infection, you have a sinus infection, and the doctor prescribes an antibiotic, if you stop the antibiotic midway just because you start to feel better, you run the risk of the infection returning. This is the same thing, if you don't complete the course of the therapy, it is a prescription, so you do run the risk of the, pain coming back, because you have not strengthened and reconditioned those muscles, to where they need to be, and learned how to use them so that you can prevent a future episode from happening. and again, this is very, very important, you know, when you go through the first phase of the therapy and we work on minimizing the pain, a lot of people will tend to do this, you know, my pain is gone, so why do I need to continue? So just because the resolution of the pain alone doesn't mean that the underlying issue has been fixed. So if you stop the therapy midway, you run the risk of the pain returning. So it's very important that you work to completion so that you have reconditioned the joints for full mobility and strength with long-term maintenance, and learn how to continue to maintain the condition so that you prevent a future episode. So can't I just do some stretches? Yes, stretching is great, everybody should stretch, but you need to know the right muscles to be stretched, because if you end up stretching the wrong muscles, even though it may feel good while you're doing it, you're not going to help the problem. In fact, if you end up stretching the wrong muscles, you could potentially, worsen the condition.
Excuse me.
So that yoga class I took the other day wasn't a good idea.
I mean, if you were in physical therapy, we would talk to you about what exactly are you doing and guide you on which ones to stay away from, so that's a very important part of, what we do when you come for the treatments, is talk about, what activities you're doing every day and guiding you on which ones could be potentially detrimental to your condition and which ones are okay to continue, so. Can I just go to the gym? So again, going to the gym is a good thing, everybody should exercise. However, when you go to the gym and you just lift weights, you are really only strengthening the large muscle groups. And in physical therapy, what we work on is strengthening those intrinsic muscles, which are the muscles, that are important to helping stabilize the joints. So the exercises you will do in physical therapy are nothing like what you would do in a gym. At some phase, you may, get to the point where you start doing, lifting and that kind of stuff. But again, we're not going to start you with exercises that you would do at a gym, because again, the intrinsic muscles are very small muscles. The movements that we will work on are very subtle movements that are important to the stability of the joint. The joints that are, the muscles that are, immediately covering the joint are very small, and they need to have a lot of strength to be able to support the joint. Without that support, the joint cannot function the right way. Do I need to see a doctor before I can do physical therapy? So by law, you do not need to see a doctor. You can see a physical therapist without seeing a physician. However, we will collaborate with your primary care physician or your specialist and update them, as soon as we've done an evaluation, we will update your doctor, keep the doctor informed about, your initial plan of care, your progress. We constantly send progress reports and update them and, keep them in touch with what's happening with your care.
What about insurance?
So, physical therapy is covered by insurance.
But don't you need a doctor's prescription?
No, it depends. Only Medicare is something that we need a doctor's signature with a plan of care. So you can still go through an evaluation. So insurance is something that you could discuss with the front desk, once you, so let me get through this and then we'll talk more, okay? And then, but I've tried physical therapy before. Sometimes patients have already gone through physical therapy at another facility, and then, they're not better, and so they come to our workshops and they're like, well, I've tried it before, how do I know if this is gonna help again? So, we are a physical therapist owned facility, so we're not like a typical, corporate owned where, it's a cookie cutter approach, you know. Same set of exercises for every shoulder. We don't operate that way, you know. Our reputation depends on treating you to, as an individual with your unique condition and customizing the treatment, you know, again, for your unique condition. So, we don't do a cookie cutter approach. You know, obviously we've been in business for 35 years, treated, you know, numerous shoulder patients along with, of course, you know, many other conditions, and had a lot of success. So, you know, the treatment approach that we take is very unique. And we are all about, you know, healing. So even after physical therapy is completed, you know, we back you up with continuous healing programs, you know, which are available to our patients. And, you know, we're always in touch with our patients. So if there's ever a question, you know, people stop by, and, you know, have your questions answered, or, you know, we're constantly updating our website and our Facebook page that gives you information that's helpful for long-term care. So, I could show you a couple of exercises which are very, you know, generic in the sense that, because I don't know each of you, I would only be able to tell each of you after an evaluation whether or not this exercise is appropriate for you. But if you are interested in, you know, just trying out a couple of exercises, we can do a couple of exercises, so you kind of get a sense of, is everybody up for that?
Mm-hmm.
Okay. Dylan, you wanna come up here and I'll just demonstrate on him. Okay, so the first one is going to be the, this one with the shoulder blade squeeze, that one.
Mm-hmm.
So that is very important for good posture, thank you, Joe. So, if you remember the picture that the slide that I had up there with the young lady who was, you know, had a rounded upper back. So this is what I was talking about, you know, the shoulder blades, if you hunch for me, yeah. So once you're like this, you see this starts to go, it starts to turn, it starts to protract. And the muscles on the front start to get tight. So in order to fix that, one of the exercises that we work on is to just squeeze the shoulder blades together. So you wanna work on shoulder scapular retraction. So the shoulder blades are called the scapula, and we basically help to strengthen, you know, those muscles, you know, to squeeze them and then, you know, and then just relax it. And as you strengthen that muscle, it helps to recreate the balance, so that the muscles on the front that have gotten tight, they are not overpowering anymore, because, you know, when this is tight, those muscles get weak. So in order to correct the posture, you know, and fix the position of your shoulder girdle so that there's less strain on those shoulder muscles, that's one of the exercises we would do. The other one is, you know, for the neck, and basically you just take a scarf or a pillowcase or something, and just like I'm doing over there, and this is just to support the base of the neck, and then you're just going to work on, you know, so that just helps to stretch the neck. So, you know, again, how many to do, how long to hold it for, checking your technique. We're good, thank you.
You are.
Checking your technique. I mean, Dylan is like in his 20s, so.
Still made of rubber.
Yeah, exactly. So his scapular retraction, you know, was easy, but believe it or not, a lot of people with, you know, poor posture that have gotten over time, they're like this, they just cannot even use that muscle anymore. It takes a long, it's such a small movement, but they, you know, their muscles have just forgotten how to even work. So, you know, those are some of the things that, you know, need to be worked on. So, how many of you wanna live with the pain that you have? Raise your hand.
Wait, hold on.
And how many of you wanna do something about it? Raise your hand. So, I'm gonna let Joe take over now.
Yeah, I'm glad you included those exercises. That was a good example. Right, so that one with the towel where you're looking up, for example, that'd be a patient who's having nerve pain down the shoulder, right? And we kind of want to decompress the disc. Whereas if someone's suffering from impingement, we'd give them maybe a scapular retraction as shown, right? So that's a perfect example of how we kind of fine tune movements based on the condition. I would highly recommend, you know, if it's affecting your occupation, horseshoer, photographer, Bob's Lumber.
Landscaper.
Yeah, exactly. If it is affecting your occupation, I highly recommend at least sitting down for an evaluation. We have a couple of slots this week and next week with our physical therapist, either Dr. Raji or Dr. Patel. Also, most of you should have got a survey on the second page in your clipboard. If you don't mind filling that out quickly, that'd be great. And then just by a show of hands, how many would be interested in taking a couple of those slots in the next 2 weeks? Isabella? Okay, and Randy. Awesome. So then what I'll have you do, Isabella, after you fill that out, you can follow Dylan to the front desk and he'll help schedule you. And we'll answer any questions regarding insurance. Nancy, I know you said your shoulder's kind of on the fence,
She
it's not
had a
too bad.
question about the insurance too, so.
Yeah, we could, I'll talk to you after a while. as well.
Actually, I'm gonna head out,
Okay.
but, I just remember that for at least my health insurance or my plan, that you have to have a prescription from the
Yeah.
doctor to get,
Yeah.
okay, for physical therapy.
So we're kind of a direct access clinic in the sense that you could come to us, we evaluate you, then we fax your evaluation within 24 hours to your doctor. Your doctor signs off on it, and then we're approved for X amount of visits. So we kind of,
I know my doctor, he wouldn't sign off on it without
Oh, really?
seeing me first.
yeah, okay.
Yeah,
So you can
so
talk to your
that's-
primary, evaluate, and then,
Yeah.
he should write a prescription, given, you know, he'll do a few tests. Have you ever had a doctor kind of deny the eval? No? Okay.
No, but I know my doctor, he'd wanna see me.
Really? Yeah. He's a DO.
He's gotta have his hands in.
Yeah, okay. Fair enough.
And I
Alright.
just haven't felt the need to do that yet.
Yeah, okay.
You know?
Yeah, I'll give you a few seconds to fill that out, and then we'll break. And then David, I know you have some questions regarding Cigna, so we could talk about that too, one-on-one.
That's why I have Cigna.
You have that as well?
Cigna Great West.
Okay.
Saying that just drop Premier Health,
Oh, no.
all of Premier Health.
That's like the good stuff.
Any questions,
Yeah.
Bob?
No, I'm good.
How the hell
No.
did they do that?
I'm gonna continue doing the exercises that my doctor gave me.
Okay, great.
Say it
Everything hasn't
nicely.
worked.
Yours
And I have
has
seen
Guardian
an
and
improvements, but.
I had
You have
one
one,
life,
right?
we had United
Awesome.
Health and mine.
You were chopping wood or chopping a tree?
I was splitting wood.
Nice.
Just changed insurance all the time, and now I have Cigna.
And you felt it afterwards or while it was happening?
Worse than
Yeah.
worse
Are
things
there
happen.
any good plans out there?
Too old to do that stuff.
It's almost like they should.
It's so fun.
I enjoy it.
It's a great workout.
Find something that's decent to an individual, why do you even, you know, give it?
Thank you so much.
Thank you
Nancy,
much.
thanks so much for
Thank
coming,
you.
yeah,
Thank you.
appreciate
Thank
your
you very
time.
much.
Good meeting you.
I like
Thanks,
your
Doctor.
sneaks up on that.
Oh, thank you.
Did you do
All right,
that?
Bob, yeah, I'll be in touch if it
Yeah.
gets worse.
You got it. Okay.
All right.
Thank you.
You took our business card, right?
Yes, I did.
Excellent, have a good night.
You do the same.
Have a good one.
Nice job.
Done, Randy? Okay, I can take that, and then you can follow Dylan up front. I'll get you scheduled within the next week or so.
Okay.
Got a couple slots available for you.
Where is a holistic healing class? This is.
So that's your,
Pretty good, yourself?
aside from physical therapy, yeah, we do offer continuous healing or holistic healing classes, which is essentially a continuation of physical therapy. So given that you're in pain, what we would do is have you continue a plan of care under the physical therapist. Once you're, 100%, you can continue exercising here.
Oh,
But that's for later on, right,
Okay.
after physical therapy is completed, let's say.
alright, cause right now I don't
Yeah, okay. A lot of weddings.
have a lot of weddings and editing.
Yeah. Does it hurt when you're at the computer?
Yes.
Yeah, okay.
Okay, that's this one?
Done, thank you so much. That was just for you to take notes, if you didn't,
Oh.
okay. Yeah, you just take the business card, don't worry about it. Thank you.
And then what's yours?
Thank you. Yeah, and then you can head up front, and Dylan will help you schedule.
Alright. Thank you.
Yeah, you're very welcome. Nice meeting you.
Likewise.
And then David, I'll be right out here, okay, to talk with
No
you.
problem.
Isabel, I'll take you right here, actually, so you're not waiting. What time of the day usually works better for you?
Afternoon. So. Like this is good, actually. Like,
Thursday, like this Thursday, 3:30.
I kind of. Alright, yeah, cause
Would
I
that be
do,
better?
yeah, I do have to studio, so.
Okay.
It's a highlight.
Finish with that? Go for a hike?
No, it's a hike to get to the studio.